وفي عندنا الميدل لاير اللي هي الكرويد زي ما احنا شايفين هون. في عندنا inner layer الريتنا. هلا احنا بنقدر نقسم الجلوب into two major segments. الانتيريور segment اللي هي the lens, and what's anterior to the lens, the iris and the anterior chamber and the cornea anteriorly, and the posterior segment which compromises the vitreous and the retina and the optic nerve head here. الانتيريور segment يعني القطعة الأمامية من العين can be divided by the iris into an anterior chamber which is the volume of space anterior to the iris and posterior to the endothelium of the cornea. وفي عندنا a small slit area we call it the posterior chamber which is located ما بين اللينس والiris أو بين ciliary body processes والiris. We will talk about some of the lens or lenticular disorders. We will talk about some lenticular disorders in this seminar. هلا إذا بتطلعوا في هنا خطين هيك جايين بنص اللينس. They are meeting just in the posterior part of the lens here. اللينس هذول راح يكونوا هم اللي بيمثلوا في عندنا اللي هو الفيجوال اكسس او هم اللايت rays which are coming from any object we are viewing. زي ما احنا شايفين برضو اللينس is located in the middle here. anterior إلها في الايرس, posterior إلها في الفيتريوس. It's hanged or it is fixed with the suspensory ligaments which are originally coming from the ciliary body here. The lens itself is located again here. It is many nearby structures. It is near to the cornea, near to the iris, near to the ciliary body. So any disease of these structures also can affect the lens itself. A lens embryologically is of an surface ectoderm origin. لذلك برضو في كثير من diseases that are affecting the skin, they might also affect the lens itself. A lens is compromised, يعني نقدر نتخيلها as a bag which is compromised of the capsule outside, وفي عندنا nucleus in the inner side here, and we have a cortical lens matter surrounding the nucleus here. A lens capsule anteriorly is compromised of an epithelial cells. هذول epithelial cells, they can proliferate, and when they reach the equator, they will make a lens fiber that will surround the nucleus. And by time, these lens fibers, they will accumulate concentrically, and they will be left over out of their organelles. So they will be left only with a cytoplasm that is very clear and compromised of lens proteins. We call them crystalline proteins. So the proliferating part of the lens is the anterior lens capsule here. The posterior lens capsule is acellular organ. في النهاية, it does not have any cells. It's very thin in comparison to the anterior lens epithelium.